I'm Dr. Donna Gurley, and today is an overview of the U.S. healthcare system. Most of the materials that you need to know are found in the readings. This video is designed to show future directions of healthcare that aren't covered in the text. I hope that you can see where healthcare can fit into the healthcare system to improve it. In the past, public health professionals have worked in local health departments, separate, while healthcare professionals have worked in hospitals, again separated. Over the past decade, that has really changed. Public health professionals are now working in healthcare organizations, and healthcare workers can be found in a community setting outside of a hospital. I want to give you a little background before we talk about this slide. OECD stands for the Organization of Economic Cooperation and Development and consists of over 30 democratic governments across the globe. OECD member countries account for 63% of the world's GDP or gross domestic product, 3/4 of the world trade, 95% of the world's official development assistance, over half of the world's energy consumption, but only 18% of the world's population. So the countries represented in OECD hold a lot of economic power, but represent less than 1/5 of the world's population. Now, according to the OECD, the U.S. spent more money per capita on healthcare than any other country. The OECD average was $3,300 US dollars, while the U.S. spent over $8,500 per person on healthcare. Gross domestic product, or GDP, is a barometer of a country's economic health. Still looking at healthcare spending as a percentage of the GDP, the U.S. again spends more money on healthcare, almost 16% of its GDP, compared to other countries. Keep this statistic in mind as we look at the next slide. With the data that we've just seen, and the U.S. spends more money on healthcare per capita and percentage of its gross domestic product, let's now look at rankings and outcomes. Most people assume that because the U.S. has such a developed healthcare system that we surely have the best healthcare ranking and outcome. However, this slide will tell a different story. The countries are listed at the top by their flags in alphabetical order, and the U.S. is on the far right. For color coding, dark blue is the top tier, light blue is average, and white is the bottom tier for rankings. This chart is based on 2013 data from the Commonwealth Fund. Compared to other developed countries, the U.S. does not rank in the top tier of any of the outcomes listed, and we come out dead last in efficiency, equity, healthy lives, and overall rankings. What this means is that we are wasting a lot of money with poor results. Now, if the U.S. healthcare system was a business, it would be bankrupt. If you look to the left of the U.S., I think we have some lessons to learn from the UK based on rankings and expenditures. What do you think? More data from the Commonwealth Fund shows on the left that the U.S. does a poor job at delivering affordable health care to those who cannot afford it. Only the UK does better than any other country listed. The U.S. also has a very inefficient system of time spent on paperwork, with almost 1/5 of patients reporting this, compared to only 2% of the UK respondents. So to summarize what we've seen from these 4 slides of data, the U.S. spends the most money on healthcare, has some of the worst rankings, and doesn't deliver affordable, efficient care to poor people. We will spend some time both in this module and in future modules this quarter talking about how we can make healthcare better in the U.S. Here are some trends in healthcare that I want to share with you. In the U.S., a brief history of healthcare is given, which has been a combination of both private and government healthcare funding. In the 1960s, the role of the national healthcare expanded with the introduction of Medicare, or health care for the elderly, and Medicaid, known as Medi-Cal in California, which is health care for the poor. It wasn't until 45 years later that any significant policy changes were made to the national health care, which occurred in 2010 with the Patient Protection and Affordable Care Act, or ACA. This is informally known as Obamacare, after President Obama signed the act into law. With the new Republican administration in 2017, it is unclear what changes lawmakers will propose to the ACA, including the repeal of it. Since 2010, there has been growing political uncertainty, and that has become evident in the recent elections and proposed repeal of the ACA. In addition, money spent on health research has increased, but this has not translated into improved health outcomes. Other trends in healthcare in the U.S. include a shift to outpatient care rather than lengthy hospital stays. Reasons for this shift include reduced cost and improved patient outcomes, such as less nosocomial infections and faster healing times. However, this leaves a glut or excess of hospital beds in the U.S. With increased costs of healthcare, primary care and prevention have been recognized as deficient or lacking, not only in services provided, but also in funding. Most healthcare organizations have specialists who care for specific patients and diagnostic codes, such as internal medicine physicians and diabetic patients. However, this shift over time is a result of reimbursement from insurance, both private and government, based on diagnostic codes. This translates to fewer physicians who actually go into primary care due to a lack of funding for these generalist positions. Physicians and other healthcare workers reside in larger metropolitan areas, which means that rural areas and areas with lower socioeconomic status have less healthcare resources. In turn, this leads not only to a lack of access, but a lack of basic healthcare services for these areas. More trends in the U.S. healthcare include growth in technology, shifts in healthcare ownership, changes in healthcare regulations such as quality, patient safety, and reimbursement. Managed care has taken over healthcare, which means that a patient's healthcare is controlled and follows a standardized plan of care, reducing length of stay and requiring oversight and approval of diagnostic services for patients. Outpatient, ambulatory, and retail centers have shifted healthcare away from hospitals to other clinic areas. One example is the growth of dialysis centers away from hospitals and healthcare organizations out into the community, such as retail areas. Using technology to diagnose and treat patients, particularly in rural settings, through mHealth or mobile health. And making a patient's healthcare record electronic and accessible with other healthcare practitioners. It is now rare that a patient hand carries copies of their medical record or imaging films to their appointments. eHealth includes electronic medical records and is incorporated with other patients' health data to create large data sets. The future of healthcare includes analyzing big data to determine trends and needs for the future. That's better known as population health, and public health plays a huge role in helping organizations to plan for the future for their patient population, particularly for preventive services. I hope that you can see through this brief presentation that healthcare in the U.S. is changing and continues to evolve around reducing costs. Public health professionals must do a much better job of demonstrating how healthcare needs public health in order to achieve cost reductions and improve efficiency through prevention. Thanks for watching.